Welcome to the MedEvidence podcast. This episode is a rebroadcast from a live MedEvidence presentation.
Well, thanks. It's a pleasure to be with all of you here this afternoon, and I'm as excited as you are about hearing about taste and smell. I've known Dr. Greene for some time, and he came to Jacksonville years ago, established a clinic that's been unbelievably successful, and has also become a committed member of our community in Jacksonville. And without further ado, Charles, why don't
Hello,
you
everyone.
teach us about taste and smell.
Okay, I shall do that. I'm honored to be here. First of all, I don't have a lot of opportunities when I get to spend time with my father. I've known Dr. Rothstein for a long time, and he is one of my favorite humans. He has a rare combination of generosity, kindness, intellect, and charm. So I'm just happy to spend time with him. And I was joking in the back with our moderators that we have a relationship that's well understood. He asked me to do something, and I say yes. And I have a tremendous amount of respect
Well,
for
thank you,
Mitch,
Charles.
and I'm so
I feel
happy
the
to
same
be
way.
here. I'm happy to be here. So today we are talking about can't smell or taste. Is it allergies, COVID, or something else? And this is a pertinent topic. And what we want to find out is how important it is. And then I may we're going to be having an interactive conversation. But by show of hands, how many of you out there either have had or know somebody that's had a smell or a taste problem? So that's almost everybody. Is there anybody out there that you don't know anybody that has had a smell or a taste problem, or you haven't had it yourself? So that's everybody. So everybody knows someone that has either had a smell or a taste problem. So it's pretty prevalent. So this is a summary of what we're going to talk about. The first thing is why does smell and taste matter? Well, we know one answer because everybody knows somebody that has a smell or a taste problem. But what we want to focus our attention on are what are the common causes of the smell loss, and then how do we evaluate it, what can be done about it, and then we'll have a question and answer period. Does that sound all right to you? Okay. So many of you, since you've all had this problem or know somebody that has a problem, you probably already know the answers to all these questions. You just may not know how to articulate them right now, but you shall be able to do so after this talk, okay? So the first question is, why does smell matter? Is there anybody out there that think they could say why smell matters? Anybody? No? Why does it matter to you? She says smell matters because it can affect the taste of everything, and you are correct. Anybody else? Yes? So I'll help articulate that even further. What he's saying, if it don't smell good, don't go there. If it doesn't smell good, you might not want to go in there. And if it smells bad, you might want to stay away. Anybody else? It enhances your experience. What kind of experience? So he's saying that if you smell is key to having an enjoyable life, enjoying experiences. Anybody else? One more. Good perfume. That's a good one. That's a good one. Like if you smell perfume, it might make you, or cologne, if it smells good, if it's a good smelling perfume or a good smelling cologne, you might actually like that person better than if they came straight from the gym, right? You might be attracted to that person. Okay, well, let's see. So smell affects memory and emotion. How many people knew that? Smell, well, we got the emotional part, liking somebody, feeling good about something. That's important, and that happens because, as you can see on that slide, you see the blue is the olfactory bulb, and it's right next to the brain.
Point it back to
Let's point it back here. Oh, let's see. Oh, look at that. Thank you, Dad.
Yeah, I've been here
I love
before.
you so much. I appreciate you.
My pleasure, sir.
That's why, mentorship is good. Okay, so right there is the olfactory bulb, and it's right linked to the brain, and there's some areas in the brain that govern emotion, and the temporal lobe of the brain. We'll talk about that. But it does affect emotion and how we perceive experiences and how we perceive people, and actually your memory. So a certain smell might actually remind you of somebody or something, right? It might remind you you want to go back to that restaurant again because the food smells good and it tastes good. So everybody's on point. I told you could do this lecture. All right. So smell, somebody said it's your first safety alert. Stand up and give this gentleman a hand. Give yourself a hand. Stand up, sir. There you go. And what kind of hat is that? Is that a, did you serve our country? U.S. Army. Well, thank you so much for your service. All right. All right. All right, and those caissons go rolling along, right? Okay, so smell is your first sense of safety, and you can see on the slide, if something is burning, they should have had a kitchen up here, right? If there's something's burning in the kitchen, or if you go to a restaurant, it doesn't smell good. We know that gas companies put mercaptan in the gas. So gas is odorless, scentless, and tasteless, but they put something in it so you know when something's burned, when you left the gas on in the house. But if you can't smell and you leave the gas on in the house, something bad can happen, right? The house can burn down. So that's a warning center. Now, somebody in the front, told you you're going to give this lecture, said that smell affects your taste. Didn't you say that? Let's give her a hand. Right answer is get a hand. Okay. So smell affects the taste and the appetite, and we'll show how those things occur in a moment. So you're right all the way so far. And then why does taste matter? So we already talked about the smell. Why does taste matter? Let me be very clear about something. I'm going to share with you a little bit of personal information. If you were to tell me that you could not smell or taste, you could be rest assured that I'm not going to come over to your house and let you cook for me. I just don't want any. I don't care what kind of cook you used to be, but if you cannot smell or taste, that's all right. No, thank you. Because I don't need you to just measure. I need you to know what's good. If you can't taste, if it doesn't taste good, then you're not going to what? Eat it. If you're not going to eat it, you're going to get what? Skinny, right? Real skinny. Skinny, not good looking skinny either. Bad looking skinny. All right. You like the slide? Isn't that cool? Look at that. That's a cool slide. All right. It drives the enjoyment of food. Who said that? Did you say that? Look at that. Give him a hand. Come on. And give her a hand. I didn't forget you. All right. So it drives the enjoyment of food. So it creates a lot of pleasure. And then somebody said it affects nutrition. Look at that. You're doing my slide. Come on over there. Another hand. Come on, y'all. I mean, I used to be slow. You guys know I'm going to say give a hand, so just give a hand. All right, so it affects your nutrition, and nutrition affects your what? Your quality of life. You don't eat, you're going to get thin, you're going to be weak, you won't feel good. People who are trying to recover from illness, nutrition is super important. Someone who has cancer, who's trying to recover, the first thing you're going to tell you is, we need to get you some nutrition. If you can't eat, we might put an IV in, we might put a feeding tube in. We have to do something to make sure you have nutrition, because nutrition is important for healing. All right. Now, this is misunderstood by many people, but not the people in this audience, that often it's misunderstood is that smell plays an important role in taste, and we'll see why. So, in order to understand how smell and taste work together, we need to know how do we smell and how do we taste separately. So that's what we're going to talk about in the next couple of minutes. So first of all, this is complicated, but the talk is simple. So we have smell is mediated by cranial nerve number 1. That's the olfactory nerve. And taste, several nerves, 7, 9, 10, for different parts of the tongue. And so you have nerves. So basically what happens is that for smell, odors go into the nose, they bind to receptors, which create electrical information that the brain can interpret, and the same thing happens with taste. There's receptors. Receptors are just little things that bind things like odors, or in the brain, neurotransmitters, the way the brain communicates. One cell sends a signal, it binds to the next cell, and that's how the nervous system works. And so one of the things that's important in the nose is being able to get airflow in the nose. That's why you don't want to smoke. If you smoke, it kills the cilia in your nose won't work right, And does it have any effects on the lungs?
Yeah, big effects. Same kind of issues. That once you hit the cilia and you can't transport mucus, causes dysplasia and abnormalities on the inner lining cells. It destroys what the lungs are trying to do.
Yeah. So in simple terms, it makes your breathing jacked up, and your breathing jacked up if you smoke. Smoking is bad for you, and smoking is one of the leading causes of head and neck cancer. Over 95% of the people who smoke get head and neck cancer. What percentage get lung cancer?
Overall, depending on how much you smoke, there is a kind of a dose dependency, but about 30% of smokers will get cancer during their lifetime. They're smoking more than 20 pack years. So you smoke a pack a day for 20 years, we call that pack years of smoking. So if you're smoking 2 packs a day for 15 years, that's 30 pack years, so you're in that category, that more at-risk category. And the sooner you stop and the longer you're not smoking, the more your reduction in your chance of getting lung cancer will be.
What about if they don't get cancer? Can the smoking affect anything else in their respiratory system?
Everything. Just like you were talking about with the sense of smell and taste, it affects the ability of the lung to transport mucus up the airway and leads to increased rates of infections, conditions like chronic bronchitis and bronchiolitis. It can cause eventually tracheomalacia, where your airways actually collapse. So there's a myriad of other insults that the lungs get from inhalation of smoke, just besides cancer.
Yeah, so if you think it's butter, but it's snot, the snot is actually good. It's not chiffon. I just said that to date myself. How many people in here know that commercial? If you think it's butter, but it's not, it's chiffon. You remember that? In my clinic, I used to say, if you think it's butter, but it's not. I might have been the only one that thought, but mucus is good. So most people think mucus is bad, but mucus is important. It's important for transporting stuff. So in the nose, we make mucus. It's called a mucociliary blanket. It traps particulate matter, and the nose makes mucus so that dust and dirt and all that stuff get trapped in the mucus. It gets filtered in the sinuses, and then you swallow it. It goes into your, I mean, don't y'all act like y'all don't swallow mucus. I saw somebody yesterday in my clinic, a little boy, and I was just joking around because I think I'm funny, and I said, you probably eat boogers, don't you? And his mom says, he does not eat boogers. He said, yes, I do. And then he started trying to demonstrate the boogers that he eats, you know? And then we couldn't get him to stop. I said, look, man. And then he said, Dr. Greene, he said, did you ever eat boogers? I wanted to lie to that kid so bad. I was like, yeah. I said, they're kind of salty, aren't they? He's like, yeah. But we bonded over that. You know, you can bond over things in common. You know, we bond over common things. If you meet somebody, if you eat boogers and you want to get along with somebody, just find somebody else that eats boogers. You'll probably get along.
That's how we met.
That's how we met. That's right. Yeah, I was leading up to that. So the airflow, the mucus, and the brain all play an important role. And this is how we smell. So really, anybody here like cherries? Is there anybody here that doesn't like cherries? That's why I picked the cherries, because most people like cherries. You could pick certain, you know. But anyway, cherries and any other things, they emit these little chemicals, these little molecules, and the molecules travel up through the nose, past these tissues. All the tissues have names. Like this is the turbinates and blah, blah, blah. I'm not going to use a bunch of names unless you ask me to. But it flows up into the nose, and then it goes up here. These are those receptors I was talking to you about. And the little chemicals bind to these receptors, which open up electrical channels. Basically, they're little pores and little salts go in there. And the salts are charged. Like sodium has a positive charge. Chloride has a negative charge. Everybody knows what table salt is, right? Sodium and chloride, right? And so it binds to these receptors, and then it transduces this chemical, changes, that's what transduce means, transduces this chemical information into electrical information that the brain can understand, and then it travels down this olfactory or smell nerve to the parts of the brain where it can interpret what the smell is. Pleasant. Isn't that cool? Yeah, that's cool. I like the wow. Yeah. Who said wow? Can you say it louder like you really mean it? Yeah, there we go. There we go.
That's fascinating, because you often hear stories about how people will smell something and it evokes a very emotional memory. And that amygdala part of the brain is like your emotion center.
That's right.
So that's how, I never really understood that connection, but that's fascinating. That's what kind of brings that back out, is that emotion generated from the amygdala to smells.
Well, you know what? I'm feeling emotional right now because I always really wanted my dad to think I was doing something good. Today, I might have to step off stage for a minute. Thank you, Papa.
He's going to be here Tuesday and Friday night, 7 p.m., in case you're interested in the follow-up shows.
Oh, yeah, this is so cool. This is like a bonding experience. I've been estranged from my daddy for a little while, but now we're making up for it, so it's all good. All right, so, and how we taste. So it's same, but a little different. So really, there's receptors here, and then for different parts of the tongue, the tip of the tongue, the sides of the tongue, the back of the tongue, and then they go up to the brain, and they go up here, and they go to places in the brain that can interpret it and can make meaning of it. Is it a good thing? Is it a bad thing? So that's how it works. So that's how we taste, that's how we smell, and so now that we know that, we can say, where does smell meet taste, right? How do they work together, right? That's pretty cool. So the smell and the taste meet in what I call the yummy center, right? So the smell sensors go to this part of the brain, and the tongue goes to this part of the brain. Dad called it the amygdala.
Who's Dad? Oh. Is that where it is?
See, this is how it started. I used to tell people he was my dad, and he'd go like, he used to tell people we don't look alike. Put your head up.
Yeah.
How do you say we don't look alike? We look just alike, right? He's got a little more hair than I do. I mean, it's all right. I cut my hair. My hair can grow like that, but I didn't want it to be white like his. I just white down here, not up at the top.
Gray.
Yeah, gray. Sorry. I'm sorry. It is gray. Okay. This is not white out in my case. It's gray too. So that's the yummy center. So taste and smell are integrated in the brain, in the center that Dr. Rothstein indicated is the amygdala. That whole system where emotion is controlled is called the limbic system. And in that limbic system is the hippocampus. And many, many years ago, when a lot of you were kids, I was at the Center for the Neurobiology of Learning and Memory, and I used to do research in the amygdala. I used to stick cannulas into the head of laboratory animals. And I'm sorry to say that, but that's how we did the research. I'm sorry. I said I'm sorry already. This is a long time ago. I don't do it now. Don't act like you didn't do stuff that you don't do anymore. Don't judge me. Why you judging? Why you hating? Why you hating? Not hating, hating. Y'all know how to say that? Hating. So anyway. All right, so the yummy center. Okay, that's where smell meets taste. And so now the key question is what? What are the causes? Y'all can get this lecture. You didn't need me. Thanks for letting me come, but you didn't really need me. So what are the most common causes of smell and taste? All right, let's see. You all been doing so well? Yes? Okay. So how many people know that the flu is usually caused by a virus? So she said she had bronchitis because she got a virus. So viruses like the cold, COVID, medications can cause it. Well, certain medications, so you are definitely on the right track, and I'll talk about one of the most common medications that probably all of you have taken that can cause you to lose your sense of smell. Head trauma, injury to the brain, vagal nerve. Well, that was that 10th nerve. The vagus nerve is one of the nerves that mediates taste on the tongue, so you are also correct. All right, so let's see how we did. Viral infections, for example, COVID. You all are brilliant. So give yourselves a hand. Hey, don't get tired of clapping. You know, enjoyment and joy is the greatest gift in life. We ought to have joy. When we can clap, when we can celebrate, when we can lift other people up, when we have something to be excited about. We should be excited about the fact that nobody in here has COVID, unless you're a super spreader. And don't feel bad about that. You didn't know. Like his wife didn't know she was going to give it to him. Or maybe she caught COVID and said, okay, I'm going to fix his butt. I'm going to give him some COVID. All right. I'm sure that would never happen. I'm just making stuff up. Don't listen to me. All right. So this is one nobody talked about that was very common. Allergies and sinus infections. How many people in here know that Jacksonville has one of the highest pollen counts in the whole United States? So I would be willing to bet that at least half of the people in this room have environmental allergies. At least half, right? Right? Okay, and a lot of y'all get sinus infections, right? I learned how to say y'all. I'm from Compton, South Central Los Angeles. We didn't say y'all down there, but I learned how to say y'all. I learned how to say hanas. I use it when I'm telling people about the ringing in their ears. You know, if you have ringing in the ears, it's called tinnitus if you live in the northern United States. But down here, they call it tinnitus. Like, what? Tinnitus? The first time I walked in, I got that there, tinnitus. I was like, what? Tinnitus? No, tinnitus. It took me a while to figure it out. In the north, if you meet someone like my dad, Dr. Rothstein, you say, he is very nice. But down in the south, they say, how nice. So, tinnitus. It makes sense to me now, okay? So, allergies. So, second thing is that you didn't think about it, nasal polyps or a mass. So, this is a picture of the nose, inside of the nose, regular nose. That's a nasal polyp, soft inflammatory tissue. What type of inflammation causes polyps? Type 2 inflammation. So do polyps affect your patients?
Not often.
Not often.
Yeah. We'll get occasional endobronchial polyps, but it's not the right environment for them. Mm-hmm. So, but common in the nose.
It's common in the nose. And nasal polyps, there is a thing where the lungs and the nose meet. It's called Sumter's triad, where people have asthma, allergies, and nasal polyps, and aspirin sensitivity. So, polyps or masses, that's a big thing. You don't want a polyp, you don't want a mass in your nose. So this is a clue. So if you can't breathe out of your nose, that's one of the things that happen when people have nasal polyps. They can't breathe out of their nose is congested, and they lose their sense of smell and taste. Loss of smell and taste after a brain injury. Somebody right here, boy, that boy is... Man, come on up here, man. Just go ahead and take over. You got 3 of them right already. So loss of smell and taste after a brain injury. So that's correct. And then, of course, neurodegenerative diseases. So people that have dementia, Alzheimer's disease, Lewy body disease, which is just a form of protein that grows in certain cells in the brain when people have Parkinson's or some forms of dementia. It's a slowly progressive dementia when you have Lewy bodies. And then traumatic brain injury. So those things can all cause problems with your smell. So the question is now, how do you tell which one it is? Right? These are all the things that can cause it, but how do you know if it's allergies, if it's polyps, or is it something else? And so we'll spend a little time talking about that. So if it's allergies, this one I'm just going to do just because I don't want to take up too much time because I want to leave some time for question and answer. Allergies are usually seasonal or year-round symptoms. So if it's seasonal, you have seasonal allergies. And if it's all year round, we say it's perennial. So you have it all year round. It just means that you probably live in some place where something is blooming that affects you all year round. And so you don't have a season. Your season is every day, okay? And then nasal congestion, sneezing, itchy, watery eyes. These are the symptoms that you get. My nose is stopped up, my eyes are itchy, watery, and then people are rubbing their nose and you're blowing your nose. And if you have allergies, obviously it's reversible with treatment, so that's good news. And then, how do you know if it's a sinus infection? So this shows the sinuses. The sinuses are air-filled cavities inside of the head that warm, humidify, and cleanse inhaled air and filter out particulate matter. And this over here on the right side, this is right. Somebody's going to say, that's the left side. No, right, looking at you, right, left. So on the right side, the sinuses are clear. On the left side, what happens if you have a lot of inflammation, the sinus outflow tracts get blocked, and then you get mucus and pus in the sinuses, And if it's chronic, the outflow tract is blocked. Chronic means you have it all the time. So you can go get an antibiotic. The antibiotic will get rid of the pus, leave clear fluid, but the fluid can't drain because the outflow tract's blocked, so the bacteria grows back in there and back and forth you go. Recurrent chronic sinusitis. So that can cause it because it all starts from the inflamed lining of the sinuses. And these people complain of facial pressure, thick colored drainage. Not clear anymore, thick, yellow, green, foul smell. Some of them have a smell, and then they're tired. Allergies can make you tired too, and they may need antibiotics or surgery. Something really has to be done if you have chronic sinusitis. Acute sinusitis is if it lasts a few days, it's usually viral. But once you get past 12 weeks, if you have 12 weeks of sinus symptoms, you probably have chronic sinusitis. And what most people don't know is sinusitis is really an outflow tract disease. So when people have sinus surgery, in the old days, we used to just rip everything up. And now we realize that you just have to reestablish the normal opening of the sinuses, reestablish the normal drainage pathways, and people get better. And then if it's COVID, so COVID is different. So COVID, people who have COVID, they have a sudden loss of smell or taste, but often they don't have any congestion. It's like their nose isn't stopped up. It can be stopped up, but often it is not stopped up, and it may persist long after they feel sick. So you get the, I don't feel good, you're laying in bed, I got COVID, I don't feel good, but then the smell, it can go in the beginning, but it can go later on, even after your symptoms of feeling bad go away. So, and then some people have what's called post-COVID smell loss. It occurs in about 30 to 60% of ENT cases. It's usually temporary, can last weeks to months, but some experience persistent symptoms. Everybody's talking about that long COVID, right? Anybody heard of long COVID? Yeah, everybody talking about long COVID. 90% of the people I know, when they don't feel good, they want to do something, I got long COVID. Yeah, that's what I say. You ask me to do something, I don't want to do it. I say, I would do it, but I got long COVID. How come you forgot to take the trash out? I got long COVID. I don't remember the trash day on Thursday. Is it Thursday, Wednesday, Tuesday? I got long COVID. Everybody got long COVID. All my employees got long COVID. Well, not all of them, but there's 2 of them. They got long COVID. They never had COVID at all. COVID tests are always negative. I got long COVID. I think I got COVID. COVID changed the world, right? Anything bad happen to you, just blame it on COVID. All right. And then there's this thing called distorted smell. It's called parosmia, dysosmia. It has a lot of names. Abnormal smell. So why does that happen? It's very common after a virus. Things smell rotten. A lot of times it feels burnt or smells burnt. And then often worse during the recovery period. And the reason why is because one of the protective mechanisms of smell is to keep you from danger. So when the smell goes bad, when the nerves don't work right, and many people think that it's because once the nerve gets attacked, then their function is altered. They haven't stopped functioning, they just alter different. And they default towards unpleasant because it's a protective mechanism. Okay? So things smell burnt or rotten. So, that's me right there.
It's a great picture.
And this is Photoshop is amazing. I look good on here, right? So anyway, I have brochures in my office that we give to our patients, and of course the picture is Photoshop. I don't have no blemishes. I look good in that picture. And they be like, they grab the brochure out, they look at, I walk in with this mug, and they be like, "Are you Dr. Greene?" I'm like, "Yeah, I'm Dr. Greene. Don't you see the picture?" "That don't look like you." I said, "It's me." "Have you lost weight? Did you gain weight? Did you get trauma to your face?" I used to be a boxer. I don't get trauma to my face much. Anyway, I know how to duck. I don't get in any fights either. So, at my age, you shouldn't be fighting. Okay. Grandpa, leave that man alone. Okay, so when to visit an ENT. If you have symptoms longer than three weeks, then you need to come see an ENT. That's an ENT. No improvement after an infection, or if you have worrisome symptoms. What are worrisome symptoms? If you've had trauma, if you have bleeding, If you can't breathe out of your nose at all, those are all worrisome symptoms. If you have something growing out of your nose, that's a worrisome symptom. That might sound subtle. I have people come to my office literally, and there's something growing out their nose this far, like a polyp growing out the nose, a mass growing out the nose. And you want to say, the first impression you would say, if you thought about it casually, why did you wait so long, right? Why did you wait so long, right? But one of the things I learned to do in life is don't judge other people. If you're living in a glass house, don't throw no stones. You don't know what somebody's situation is. You don't know what they're going through. You don't know what their financial situation is. You don't know why. Some people are ashamed. It was growing out of their nose, they just become a recluse, or they wear a mask, and you don't know what's going on with somebody, so don't judge. That's a side note. All right, so what to expect from an ENT when you come. You saw that little scope I had, that's a fiber optic scope. We're gonna look in your nose with a camera. We may do some imaging, usually a sinus CT. We may do an allergy evaluation because we can find out what you're allergic to, and then we can treat your allergies. In our office, we can give you drops that go underneath your tongue to make your allergies go away, because a lot of people don't like to get shots. That's called sublingual immunotherapy. It's the same thing. To treat allergies, you give people what they're allergic to in small doses, and the body learns to ignore it. Because when you have a cold, it's not the virus or the bacteria that causes your symptoms. It's your body's army going to kill it. When you have allergies, the body's army has been tricked. It's not a virus or bacteria. It's just Fluffy's dandruff or a pine pollen. But the body's army mounts the same response, so you get the same kind of symptoms. And then sometimes we'll do a smell test. We take different things, and that also is one of the treatments. You give people different things to smell, like eucalyptus, have them do it every day, and it helps retrain the smell system. All right, so the treatment options depend upon what the symptoms are, and then finally other things to consider. Smoking, exposure to toxins. A lot of our people in the military, unfortunately, have been exposed to burn pits. So I see that where people, or people who were in Vietnam serving our country. We love our veterans, first of all. Let me give a hand to our veterans. All of our veterans, I'm going to tell you, I love you. I love you so much. And so we actually, when I first went into practice more than a quarter of a century ago, the first thing I did was say, can I get a VA contract? So we've been taking care of our veterans for over a quarter of a century, and also our first responders. So we sponsor Guns and Hoses, not just because I used to box, but we try to do everything that we can in the community and to support those who have served us. So I love our first responders and the people that keep us safe. All right, so, and neurological diseases, people who get neurological diseases have these problems. So we're gonna come to a close. How do we protect our smell and taste? And so I do want to harp on this topic for a second. Don't overuse decongestants. Afrin, Vicks, all the stuff your mama used to put your head underneath here. You know what I'm talking about. Don't. I went into medicine to put my mama out of business. I'm gonna tell you don't judge me. I'm gonna tell you a true story. I have never missed, thank God. First of all, I'm gonna say thank you, Lord. I have never missed a day of work or school in my life. Not ever. Not ever. Not ever. Not ever. And before you say he's a bad man, I say if it had not been for the grace of God, I would have gotten sick. But God protects me. And so I said it. So God does protect me, and he's watching over me. Doesn't mean he doesn't watch over you if you get a cold or you get sick. I've just been very blessed in that way. But one time when I was 8 years old, I decided I wasn't going to go to school. Mama, I don't want to go to school. I don't feel good. I wasn't really sick. I don't want to go to school. I just didn't want to go to school. So my mother goes and gets a big old jar of Vicks, puts it on my feet, puts my socks on, puts it on my chest, wraps me up in a blanket, puts it underneath my nose. I mean, I was coated in Vicks. And then she does this. She took some Vicks and put it on my gonads. You don't want Vicks in that location. So I'm heating up, and then she goes in the kitchen and she gets a pot This is a true story. She mixes something up. I think she said some words over it. My mom wasn't no voodoo lady. She just thought she was a doctor. She had all these little books. She couldn't afford to take us to the doctor. I grew up in Compton in a one-room house. All 4 of the kids slept on a pallet in the living room. Pallet, if you don't know what that is, that's just a bunch of blankets. Not a mattress, all 4 of us on the pallet. And we could hear the rats tell the bed bugs to say the roaches something. So we're on the pallet. I'm trying to pretend like I don't want to go to school. She does all the stuff to me. And then she says, whatever she mixed up, she said, drink this, son. I took a sip. I thought my esophagus was going to come out. So I got up. I think she thought I was speaking in tongues. My gonads was on fire. I said, I'm healed. I can go to school. That day, I went to school and I said, I'm going to become a doctor because I got to put mom out of business. I didn't tell him that on my interview, but that's the God honest truth. That's why I went in the mess. I said, somebody got to stop mama. So decongestants. Decongestants cause a disease process called rhinitis medicamentosa. Decongestants shrink the blood vessels. What's in the blood? Anybody know what's in the blood? Oxygen. Life is in the blood. So oxygen is in the blood. So we need oxygen to live. We need oxygen to survive. All of the cells need oxygen. The decongestants decrease the oxygen supply to your nose. You might feel better for a minute, but you just keep using it long enough. Then you're going to say, why am I stuffy again? I got to use some more of that stuff. So the decongestants decrease the blood supply. The nose gets dried out. The nose doesn't function right. And then the turbinates, that tissue on the sidewall of the nose, begins to swell bigger and bigger and bigger. Then pretty soon, the only way you can breathe is to use a decongestant. So in my specialty, we call it nose crack. Crack is whack. You don't want that. So don't overuse decongestants. These are protection mechanisms. Avoid nasal trauma. One way to avoid nasal trauma is don't talk trash. You talk trash to the wrong person, you might experience some trauma. Don't drink and drive. Don't act crazy. Don't go places you shouldn't go. You know, sometimes trauma happens, but a lot of times trauma is avoidable if you just acted a little bit different, right? I'm going to go do, you know, somebody driving crazy, honk their horn at you. Now you follow them all down the road. I'm going to follow them all the way home. That's a bad decision.
That is.
Don't you think that's a bad decision? You ain't got so mad, you're going to waste your good injury, burning up all your gas, chasing after somebody, driving up all, y'all seen it on the road? And then some of y'all get trauma because you see that happen and you slow down because you want to see. And then when the bullets start flying, you get hit in the head with a bullet, you go like, why did that happen? Just keep driving. When I see road rage, I speed up and get over. Go on down the road and I pray for the people, but I ain't, nope. Okay, avoid nasal trauma and seek care early. Okay. So that's it. We're in our Q&A period. See, that's the picture that's in my brochure. Boy's looking good, right? Looking fly. They say, Dr. Greene, that ain't you. Who is that? I want to see Dr. Greene. I'm like, I am Dr. Greene. That don't look like you. Does that look like me? Oh, come on, y'all. Come on, y'all. You're a plant. Someone told you to say that. All right. All right, so that's it.
Well, Charles, that was delightful. I think...
Thanks for joining the MedEvidence podcast. To learn more, head over to medevidence.com or subscribe to our podcast on your favorite podcast platform.